So CEDGG is a review-like civil society organization that works to empower vulnerable and marginalized groups in the society. We are based here in Nakuru County, but we have program presence in neighboring counties of Baringo, Kericho, Laikipia, and even Elgeyo Marakwet. We've been in existence since the year 2001, largely as a civic education provider in the early days. But with time, we've been able to expand our scope, not only geographically, but also in terms of the thematic areas that we work in. Under the Wajibu Wetu program, we partner with Forum Civ to implement a project called Accountability for Sustainable Development. It's a project that falls within our key result area 1 under governance and devolution. And it mainly seeks to build the capacity of local communities, the so-called vulnerable and marginalized groups, women, if you like, the young people, and even people living with disability, to build their capacity to be able to be involved in local development processes. And this project is anchored on the devolved governments, or let's say the county government, where we seek to empower the voice of local communities in service delivery. Now we realize that for counties to be able to provide services, this largely depends on the budgeting process. So through this project, we've been able to identify spaces for where these communities can make their voice heard in terms of prioritization and allocation of resources during the budgeting process. But ultimately, what we are looking for as a project is the value addition in service delivery. And through the civic engagement and the social accountability tools that we've applied, we've seen significant improvement in the service delivery points, like what we are seeing in our health facilities, where they were understaffed. Through this engagement, we have notable cases where the county government has responded by recruiting additional technical staff. And in that, we've seen improvement in service delivery. We've seen expansion in facilities to accommodate and introduce new services where they were lacking. We've seen increased budget allocation in specific areas where communities have raised concerns, like in water and in health and even education.
Talanta Africa is an activist collective. Our work is to convene creatives who use art, basically conscious art, to really do advocacy. We work largely in the areas of human rights advocacy, looking at health rights, looking at gender equality, looking at aspects of inclusiveness and democracy and governance. So we are pronounced in aspects of SDG 3, 5, and 10.
So many religions, denominations.
Additionally, we also curate a space known as Dada Fest, which is our primary lobbying and advocacy space, convening young persons of all genders, that is both the male, female, and the gender non-conforming persons. We work towards really bridging the gap between community, and that is young people, and also the governance system, where we have deliberate conversation around access to healthcare systems, and also our aspects of gender mainstreaming within the healthcare spaces. The beneficiaries under the Rights Unlimited project are the young people in all their diversities. We work with young people between the ages of 18 to 26. We are our primary target audience. I must say that during the preliminary stages of this program, we were looking at young people within the definition of she, he. But during the implementation of this project, we realized that gender non-conforming persons are a key population that really we can't ignore. The data that we had before within this geographical space was that there was limited access of these services within the public health spaces. So during the implementation phase, we really saw the gradual increment, because we are also part of the team that audits the DHI system, that is demographic Health Indicator Survey that really is a data portal by the Minister of Health. So as much as it does not capture data for gender non-conforming person, but we've seen an increment on uptake and access to these SRH services within public health facilities by young people.
Hakuna majanta, walisema watatengenezea makazi, but tukudawazi walipatia watoto wao matenda, au ndo wako huko hivyo na sukuma zile agendas. Lakini ni sawa, si unajua watatutumia armies and armies, but hizo armies tarudi back to sender. Revolution, so ina revolve around this nation. Time yetu ndo imefika, vijana wetu baki tumeungana. Hakuna matata.